MaryAnne Rizk, I'm our GM of our life science business practice. Really pleased to have been appointed and now running our go-to-market efforts at Scale. Scale is an organization with experience of over 10 years of powering AI breakthroughs. Really started from autonomous vehicles and training that data to being the leader in supporting reliable AI for frontier labs and now building enterprise AI business applications. Really, this conversation shift is really that trust deficit. I just got off the back of a meeting presenting at Davos Health. We were talking about that, where healthcare is in this reliability gap where it's most visceral and most consequential to make sure that the stakes are really high. We can't necessarily have a model that performs even 90% accurate, right? The benchmark of ensuring that reliability, whether it's on specific oncology workflow, is ever so important. We're now focusing on ensuring focus in whether we're addressing patient population or a clinical context. We at Scale are focusing on a few specific core aspects. So our domain is building evaluations to, we started our business doing data labeling, right? Being able to validate models and having human experts create feedback and forward deployed engineers. So there's a credible way of verifying that data that's auditable ready, that a chief medical officer or even a compliance officer would seek to sign off. And moreover, you didn't mention this necessarily, Stan, but let's not forget the ever-evolving FDA frameworks for AI and the recent real-time clinical trials. Within Scale, we've been able to deploy an agent called Patient Record Agent. And what we did is we recognized that physicians were spending more than 30 minutes before meeting with a patient. And so we wanted to reduce some of that administrative burden, reduce that pajama time. And so what we've done is we've deployed our patient review Gen AI solution that was able to summarize and extract all that unstructured data, create some critical prompts and decisions about that care pathway for that new patient, reducing that patient's ability to repeat unnecessary duplication of content, really earning the trust with the patient. You'll be surprised, but we've looked at some statistics that the patient's trust with the providers really increases by the number of wait times. So just recognizing some of the human aspects of feeling comfortable, right? Being driving that, the surfacing some of that historic data to also prompt the patient to ensure their safety and trust is earned right before even that appointment scheduled. And so from a stats perspective, the trust we built with clinicians is making sure we were very comprehensive of looking at that historic data.